and good evening. I'm Melisa Idris. Welcome to The Future is Female. This is the show where we find the extraordinary in every woman. I'm delighted to introduce my guest today, Krystal So Hin Pui. She's a Midwife Activity Manager with the international humanitarian organization Médecins Sans Frontières, also known as Doctors Without Borders. Krystal has just recently returned from a 6-week humanitarian mission to the Gaza Strip. She was the only medical volunteer from Hong Kong to be dispatched by MSF. She joins us now. Thank you so much, Krystal, for being on the show with me. I appreciate your time. All right, maybe you can start, Krystal, our conversation by providing us a little bit of an overview as to your role within MSF. So what exactly does a Midwife Activity Manager do, and how did you come to be deployed to Gaza?
Thank you for the questions. I'm work in Gaza for 6 weeks in between May to June this year as a Midwife Activity Manager for MSF. The hospital I work mainly was Al-Aqsa hospital, which was the last general hospital in South Gaza, as many other hospitals was shut down due to the war situation, which is no longer service other hospitals. So Al-Aqsa was the only one hospital. My primary responsibility was managing sexual health and also reproductive health care service, including reopening Al-Aqsa hospital, which I just said, and also including some other service, just like breastfeeding room, breastfeeding service, and also the malnutrition program, because there is a lot of women and babies malnutrition due to lack of food, and also assisting people. We opened the sexual violence project, and also providing emotional support to the local people.
Okay, so Nasser Hospital, correct me if I'm wrong, is that South Gaza? Is that towards southern Gaza? Okay, and you said you had to reopen the maternity side of Nasser Hospital. So if I understand correctly, it was bombarded. Was that right? Or it was occupied for a while with Israeli forces. How did it work when you were coming back to when you were in Gaza? Was the hospital operational?
Yeah, it was quite tough moment when we enter Gaza, the Al-Aqsa hospital in May. You can imagine, because when it was April, the hospital was totally destroyed, damaged by the Israeli armed force. When we enter, there is still a messy situation, very chaotic. Of course, it's very dark. It's not. We don't have electricity, but at the moment when we come enter inside, it was the window was broken, all the chair, even though the patient back was destroyed. Everyone was marked by Israeli army, so it was very chaotic. And also we can still see some dead body over the floor. So the whole team was very sad when we arrived. We entered in another hospital, but I'm very proud of the team. We are very delicate to reopen within less than 1 week. We already start to surface, and then our first normal delivery was at the 8th of May, which is when the baby cry, all the team was cry. It's a very touch and emotional moment when we hear the baby cry. Yeah.
Right. How big was your team, Krystal? How many people were working with you in the maternity ward?
Wow, because it's another hospital is really huge hospital. In the maternity unit, we have operation theater, we have ER emergency unit, we have neighbor room, we have inpatient ward. Also, we have outpatient ward. It's a huge team, more than 100%.
Wow.
Staff. So we recruit quite a lot local staff to run the hospital together. So it was quite huge team.
Right, wonderful. Were there other hospitals in the area? Is Nasser Hospital the last area in southern Gaza, or were there other hospitals that can? The reason I'm asking is, do all the pregnant women come to Nasser, or are there other hospitals?
Unfortunately, at that moment, because invasion of the Wafa area, or many other hospital was already closed, shut down, or already damaged. So it was another hospital. In terms of that size, it was the only last general hospital, because not only the maternity unit, but in other building we have pediatric department and neonatal ICU, pediatric ICU. Also, we have a huge trauma center in the other building. So as this site is the only one in Nasser at that moment.
Right. So you described a bit earlier that during the first kind of normal delivery, you heard the baby's cries, and that was a moment of joy. But maybe you can describe what does a normal delivery mean for Gaza? What is a typical labor and delivery experience for women in Gaza like during the war?
This is really tough for the moment at this moment. You can imagine, because many people displaced, a lot of times they are still living in the tent. They are suffering a lot of stress due to the war, and then they are suffering a lot of one thing is when I come back to Hong Kong, I didn't get used to that calm and that quietness. Then you can imagine 24 hours in Gaza, we can hear the bumping, we can see the bumping, the gun shooting. Also the drones flying over your head every 24 hours. So it's very tough moment for the people living in Gaza now, especially to the woman. I remember one case is when the woman arrived, we can see her leg was exposed, just like that hurt, and severe hurt, severe wound. We asked, oh, why you didn't? Why is this caused? She replied, it's because of the attack, is the bumping. So she hurt her neck. But because where she lived was very far away from the hospital, so she didn't go to the hospital at that moment. And then when she was in labor, she come to our service, but it was very sad that her baby is worse condition, in distress in her uterus. So we need to have an emergency cesarean for her. Also, she was suffering hemorrhage. So when the baby come out, it was already died. And then not only her case, we find that even though in these 2 months, the statistic is there is a lot of intra-uterine death case, also preterm labor, also the complications such as hemorrhage increase a lot due to the war situation. Beside that, there is a lot of malnutrition. Also, there is a lot of infections as well. So it's a very tough moment in Gaza for the woman and baby.
Krystal, when you described this, so she was in need, this was a particularly difficult birth. This one had complications. What happens when a woman has signs of the baby's in distress and requires an emergency cesarean, emergency C-section, what happens to the mother then, the woman then?
The woman, although she's suffering from the hemorrhage, but we are able to give her the emergency cesarean, and also we have blood transfusion to her, and then we have medication to save her life. But unfortunately, in the uterus, the baby was not good condition, and then when she come, the baby already died in the uterus. So it was very sad moment.
Is it because they don't have prenatal care? They're not able to access care for the baby during the 9 months during gestation?
Maybe this is one of the reasons, but maybe another reason is there is quite a lot of factors affecting the woman's health. For example, the war situation, the woman need to displace many times, more than 5, even though our staff more than 5 times, and also we don't have enough food. Many of them are suffering malnutrition, especially to the pregnant woman and lactating woman, and also the babies. It is very tough because they need extra nutrition food, but there is lack of food here, and also is lack of water. So there are many other factors to affect the health of all the property or all the populations.
Can I ask you, Krystal, how many pregnant women you saw on, average? You were there for 6 weeks, maybe 5 weeks of the maternity services. But how many pregnant women did you see during your time there?
Yeah, it was a huge amount because Al-Aqsa was already the only one huge hospital. Also, because the people invasion of the warfare, the people displaced nearby. A lot of people displaced nearby. So Al-Aqsa hospital, we are seeing our patient more than our capacity, 3 to 4 times. It was very stressed and under pressure to causing to our staff, because this increase of the needs of the woman and baby. From my time, we see the patient for example, for the normal delivery, every day we have almost more than 25 or 30 to 40 delivery, and then we did operation more than 10 to 20. In our emergency unit, we have more than 100 patient come. Not 100, is 1,000, more than 1,000 patient coming weekly. And then this caused quite a huge demand. And then in our pediatric emergency unit, we see the patients, babies or mother, sometimes is lying over the floor. In the inpatient, we don't have enough mattress. So sometimes the pediatrics, the patient, they need to share the bed, or even they sleep on the floor. So it's quite stress to our staff, the team as well.
Right, we're going to take a quick break. We'll be right back after these messages. Stay tuned to The Future's Female. Hi, welcome back to The Future's Female. I'm Melisa Idris. I'm speaking today to Krystal So, Midwife Activity Manager with the international medical humanitarian organization Médecins Sans Frontières. Krystal has just returned from a 6-week humanitarian mission to the Gaza Strip, where she is sharing her experiences and observations with us today. Krystal, so you described what you experienced in the 6 weeks that you were there. Can I ask you, what happens to the mothers and the babies after delivery? You described a situation where the Al-Aqsa hospital is overcrowded. There is no space. People are sleeping on floors. Mothers, babies are on floors. How? What happens after a, say, particularly complicated birth? Are patients, are mothers able to stay in the hospital and receive care after delivery?
Yeah. For the complication case, they're supposed to stay in hospital. But mostly there is due to different factors. For example, the overcrowd. Sometimes we need to early discharge some normal patients. As all and meanwhile, because the women worry about the home, they need to go back to the homes as soon as possible after the delivery. Sometimes they just stay 3 hours after the delivery, and then they go back to their tent because their family need them, and then they're afraid of the dangerous in the staying in the hospital. That cause a lot of complications. Maybe there lack of knowledge during the postnatal period, and then also they need more attention for the infections, and also they need more knowledge during the breastfeeding. So it's caused some complications as well.
Can I ask you how this has affected the emotional and psychological well-being of mothers? I mean, this is incredible trauma that the body goes through, both physically and emotionally, and going into labor during a war is, I can't even begin to imagine. What did you observe? Were you able to help with some of the emotional and psychological challenges that mothers face?
Very stressful. You can hear the baby cry because the traumatic moment. And then we are doing some activity with the children as well for the psychological support. They are drawing the picture. Sometimes they just draw the bumping and then destroy for the home. So it's very sad. And then it's still continuously until today, until this moment, this second. And then they are trapped inside Gaza, and then even though our staff, when I'm talking about with our staff, we say, now we have mental health team enter inside the hospital to deliver more counseling session to our patients. If some of the clients show some psychological symptoms, we can refer to our psychologist and also our mental health team. But our staff say, honestly, we need psychological support as well, because every single people in Gaza is suffering all this together. So it's a tragedy. They need attention, they need help at this moment, all of them. So and then we need ceasefire at this moment.
I agree with you. You mentioned a bit earlier in our conversation that you were also there to help with breastfeeding challenges, particularly because mothers are so malnourished and they're not able to breastfeed because of their own malnutrition and the blockade. How did you resolve that? Are there alternatives? Is formula available for feeding newborns in this situation?
No, due to the war situation and also the closure of the border makes all the things difficult. You can imagine we don't have enough food and drinking water. According to UN report, there are already over 22% of Gaza population is already facing acute food insecurity. And also the lack of drinking water is a huge problem. The place is not clean, the water is not clean. Even though myself, we didn't have clean water to shower. Sometimes we don't have water in our compound for two to 3 days as well. So it makes the things worse. And then there is skin disease, there is a lot of. So you can see in terms of the lactating woman, the breastfeeding, especially they are living in the tent now. They don't have privacy to breastfeeding as well. When the time I come in Gaza, I implement different strategy. For example, we provide breastfeeding room in our clinic and also in the hospital to encourage and provide this private place to the woman for the breastfeeding, also the changing the napkin of the babies. Also, we provide some food supply to the lactating women in order to support their encourage their nutrition level, and also for the drinking water as well. We provide some drinking water to the populations. Also, we have some lactation promotion, health promoter, to teach them the correct knowledge and then how to breastfeeding under this difficult situation. For example, we don't have meat, maybe we can get some more canned beans in for the proteins. Yeah, kind of like this kind of knowledge in order to help the people breastfeed.
Yeah, I mean, you've had to come up with, improvisations to provide care to your patients under such challenging conditions there. Can I ask you, Krystal, you mentioned earlier that since you've been back, you can't get used to the quiet, to the calm. How has this experience in Gaza changed you personally and professionally as a midwife?
This is an interesting question, because it's still only 1 month when I come back. I still feeling and then calming myself, because the work life in Gaza was very tough. We really work very hard and under high pressure. Staying in the war zone is a very different experience when compared with other missions. But I was very thankful and proud of the whole team, international team, and also the national Gaza team, because they demonstrate very high professional level, which I learned a lot of things from the team, both of the team, especially my unit. It is a sensitive unit because we are talking about gender. We are talking about sensitive issues such as sexual violence. And then I have many experience, but in terms of war zone, we need to set up a acute service, for example, to provide service to the sexual violence patient and survivor. It is very difficult in this situation, but we try our best. And then there were survivors coming at when the time I was here. So I learned a lot, and then I still feeling all the emotion now.
I hope you're getting some support for yourself in terms of your emotional and psychological well-being too, Krystal. Thank you so much for speaking with me. I really appreciate you sharing your experiences and your observations, but also all the good work that you do. Thank you for your time.
Thank you so much for the interview.
That was Krystal So, Midwife Activity Manager with Médecins Sans Frontières, wrapping up this episode of Consider This. I'm Melisa Idris, signing off for the evening. Thank you so much for watching, and good night.